Now, it may come as a surprise to you that medications that are used to manage very common ailments such as diabetes and high blood pressure can actually be harmful to the kidneys. Such medications are called nephrotoxic medications. Hi, my name is Kwekwe. I'm a pharmacist, and in today's video, I'm going to highlight 5 medications that can be harmful to your kidneys. Obviously, there are more than 5 medications that can do harm to your kidneys, but I believe these are some of the most common, routinely used ones, and therefore I thought it necessary to highlight those 5 so at least you can know what those 5 are. Now, the goal of this video is not to let you panic and discontinue any medication that you're taking without first consulting your doctor. The goal is to, draw your attention to it so you can have a meaningful discussion with your doctor to decide whether these medications are still relevant for you and to kind of weigh the pros and cons to see, or to even to investigate if there are alternatives that can do the same thing for you minus the risk of kidney injury. Now, with that said, the first group of medications that I want to highlight are NSAIDs. We call them non-steroidal anti-inflammatory drugs. Now, these are very common medications and they can be obtained with or without a prescription. They are used to manage a whole variety of conditions that typically involve pain and inflammation. So you can see them used in fever, in rheumatoid arthritis, and even sometimes in menstrual cramps. Examples of NSAIDs include ibuprofen, naproxen, meloxicam, and diclofenac. Now, while these medications are very useful and they are very commonly used, they can also reduce blood flow to the kidneys. Now, this may result in a situation where there may be dead tissue in the kidneys, and ultimately it may lead to kidney damage. Now, people with heart failure, liver disease, and prior kidney disease are at an even greater risk of developing such kidney injury when they take NSAIDs. So if you have a history of kidney disease, it is very important that you discuss with your doctor to see if you are a good candidate to be taking these NSAIDs. And I say that because these NSAIDs are readily available. They are over the counter. So your doctor may or may not know that you are taking them. So best practice is to clear with your doctor before you take any NSAIDs if you have such a history. Also, these medications should be used at the minimum effective dose for the shortest duration of time and should be used sparingly even if you don't have kidney disease, because if you use it over a prolonged period of time, even if you don't have kidney disease, it can be something that can, further down the line result in you having kidney problems. Number 2 is diuretics, what we normally call water pill. Now, water pills or diuretics are used for a variety of conditions, primarily high blood pressure or even in heart failure. Typical examples include hydrochlorothiazide and furosemide. Now, as useful as diuretics are, they can actually cause dehydration, which may lead to inflammation and swelling of the kidneys. And if this situation prolongs, it can actually lead to kidney failure. Number 3, ACE inhibitors. Now, ACE inhibitors can be good or bad for your kidneys, depending on the status of your kidneys. Now, ACE inhibitors are usually very easily identifiable because they usually end in IL. So we have things like enalapril, benazepril, lisinopril, I believe that's the most common one, and so forth and so on. Now, ACE inhibitors are very popular medications for high blood pressure and heart failure. As a matter of fact, if you have a healthy kidney, you don't have any issues going on, ACE inhibitors may routinely be recommended for people who are diabetic, for example, because they actually have kidney protective functions. On the other hand, if you already have a history of kidney disease, then the use of ACE inhibitors should be evaluated to make sure that it is the right thing for you. This is because it is the kidney's responsibility to metabolize these ACE inhibitors. So if you already have a kidney that is not functioning at an optimal level, then you tasking it to excrete or to metabolize something more. In other words, you're giving the kidney a little bit more work to do and the kidney is already struggling. So in the long run, this can lead to kidney damage and kidney failure. And also, this situation is even aggravated if you are somebody who is constantly dehydrated, and which unfortunately is a situation that you find more commonly in people with chronic kidney disease. Now, I must say that there may be instances where somebody is at a relatively increased risk for developing kidney disease, but still needs an ACE inhibitor. In such a scenario, your doctor will work with you. They will start you at the lowest possible dose of the ACE inhibitor, and there will be more routine monitoring just to make sure that your kidney is not deteriorating, to make sure that all your numbers are where they're supposed to be. Number 4, antibiotics. And there is a particular group of antibiotics called aminoglycoside antibiotics. Aminoglycoside antibiotics are notorious for causing kidney damage, even at relatively low doses. People with chronic kidney disease, people who have been taking these antibiotics for an extended period of time, or people who are routinely dehydrated are at a more elevated risk of further damaging the kidneys and causing kidney failure. The most toxic aminoglycoside antibiotic is one called neomycin, followed by another one called gentamicin, and another one called tobramycin and amikacin. One of the ones that is considered relatively safe or relatively lower risk is one called streptomycin. Now, granted, these medications or these antibiotics are typically used in a hospital setting, but I thought it was worth knowing so that if ever you need a medication like that, you and your doctor can discuss, and so that you'll be on the same page with your doctor. Number 5, herbal supplements. Now, without a doubt, these days, herbal supplements play a vital role in, the overall health and overall well-being of people. But I must state that most of these herbal supplements, or actually all the herbal supplements, are not regulated by the FDA. So while they may be good and they may be touted for all their benefits, if you have a history of kidney disease, you probably need to be paying a little bit more attention to some of these herbal supplements. Now, because I cannot list all these medications, I'm actually going to provide a link in the description on an article that I found on the Kidney Foundation's website, which lists some of these supplements and the potential dangers that they may pose to somebody with a history of kidney disease. Now, but the bottom line is that let your doctor, or at the minimum your pharmacist, know all the medications that you're taking, especially the herbal supplements, so that they can check for drug interactions and they can check for, whether they may be appropriate for you, especially if you have a history of kidney disease. As always, I hope you found some value in this video. Thank you very much for staying through. Stay blessed, and I'll catch you on the next video.